The improvement in life expectancy serves as a key indicator of societal progress and public health advancements. Over the past 4 decades, China has made remarkable strides in extending its average life expectancy, moving from a nation struggling with public health challenges to surpassing the United States, a country that historically led in health indicators. This dramatic shift reflects China's significant investments in healthcare, infrastructure, and economic reforms. Meanwhile, the United States has faced stagnation and even a decline in life expectancy, exposing systemic issues within its healthcare system and societal inequalities. Exploring the reasons behind these trends provides insight into how different socio-economic and policy approaches impact public health. The transformation of life expectancy in China. In the late 20th century, China faced numerous public health challenges, with life expectancy lagging significantly behind developed nations. In 1980, the average life expectancy in China was around 66 years, a reflection of widespread poverty, limited healthcare access, and substandard living conditions. However, by 2022, life expectancy in China had risen to approximately 78.2 years. This extraordinary transformation was the result of a combination of economic reforms, public health initiatives, and policy-driven investments in human capital. One of the critical drivers of this improvement was the expansion of healthcare coverage. Beginning in the 1990s, China implemented sweeping reforms that extended healthcare access to both urban and rural populations. The introduction of the new cooperative medical scheme in 2003 and the basic medical insurance program in 2007 helped reduce financial barriers to healthcare, particularly for rural residents. By 2020, over 95% of China's population had access to some form of health insurance. This level of coverage significantly improved health outcomes, as individuals were more likely to seek medical care and participate in preventative health measures. Additionally, China's investments in public health infrastructure, such as the construction of hospitals, clinics, and sanitation systems, played a vital role in reducing mortality rates. For instance, maternal and infant mortality rates fell dramatically as a result of improved prenatal care and better trained healthcare providers. Infant mortality, which stood at 45 deaths per 1,000 live births in 1980, dropped to just 6.8 per 1,000 live births by 2020. Urbanization and economic modernization further contributed to this transformation. Between 1980 and 2020, the percentage of China's population living in urban areas increased from 19% to over 61%. Urbanization brought improved access to healthcare facilities, education, and employment opportunities. Moreover, public health campaigns addressing smoking cessation, vaccination coverage, and the prevention of infectious diseases significantly reduced the prevalence of illnesses that previously plagued the population. Environmental policies also played a role. Recognizing the severe health impacts of pollution, the Chinese government implemented stricter regulations on industrial emissions and invested heavily in renewable energy. For example, China's efforts to reduce coal consumption and promote cleaner energy sources helped decrease air pollution levels, which had been a significant contributor to respiratory illnesses and premature deaths. The decline in life expectancy in the United States. In contrast, the United States, which once led the world in life expectancy, has experienced troubling trends over the past few decades. After peaking in the mid-20th century, life expectancy in the US began to stagnate in the 2010s and has even declined in recent years. In 1980, life expectancy in the United States was 73.7 years, significantly higher than China's. However, by 2022 it had fallen to around 76.1 years, now trailing China. This decline can be attributed to several systemic issues. Despite spending more on healthcare per capita than any other nation, approximately $12,914 per person in 2021, the United States struggles with inequitable access to medical services. Millions of Americans remain uninsured or underinsured, leading to delayed or inadequate care. Furthermore, the fragmented nature of the US healthcare system results in inefficiencies and disparities in health outcomes across different socio-economic and racial groups. The opioid epidemic has been a major factor in the declining life expectancy. Since the late 1990s, overprescription of opioids by pharmaceutical companies and healthcare providers led to widespread addiction and overdose deaths. By 2021, drug overdoses were responsible for over 100,000 deaths annually, with opioids accounting for a significant majority. This crisis disproportionately affects working-age adults, reducing the overall life expectancy of the population. Chronic diseases such as obesity, diabetes, and heart disease also contribute to the declining trend. The prevalence of obesity in the United States rose from 15% in 1980 to over 42% by 2020. This increase is linked to unhealthy diets, sedentary lifestyles, and socio-economic inequalities that limit access to nutritious food and exercise opportunities. These lifestyle-related illnesses exacerbate health disparities, particularly among lower-income populations. The COVID-19 pandemic further highlighted vulnerabilities in the US healthcare system. The country experienced one of the highest per capita death rates globally, with over 1 million deaths attributed to the virus by 2022. The lack of a coordinated public health response, combined with vaccine hesitancy and misinformation, worsened the toll. The pandemic also underscored the social determinants of health, as marginalized communities faced disproportionately high mortality rates due to pre-existing inequities. Socio-economic inequality remains a fundamental challenge in the United States. Income disparities, educational gaps, and limited access to resources perpetuate cycles of poor health among disadvantaged populations. For example, African Americans and Native Americans have consistently lower life expectancies than their white counterparts, reflecting systemic barriers to healthcare and other essential services. Comparing the approaches. The contrasting trajectories of life expectancy in China and the United States reflect fundamentally different approaches to public health and socio-economic policy. China's centralized governance has enabled the implementation of large-scale health initiatives and infrastructural projects. By prioritizing universal healthcare access, preventative care, and environmental sustainability, China has achieved significant health improvements across its population. In the United States, the profit-driven nature of healthcare has created systemic inefficiencies and barriers to access. While the country excels in medical innovation and technology, these advancements are often inaccessible to lower-income individuals. Addressing these challenges requires a shift toward equity-focused policies that prioritize preventative care and address the root causes of chronic diseases. The broader implications: the rise of life expectancy in China and the decline in the United States have broader implications for global health and development. China's achievements demonstrate the potential of targeted investments in healthcare and infrastructure to improve population health. However, the United States' decline serves as a cautionary tale, highlighting the consequences of systemic inequality and the need for comprehensive reform. Both nations face challenges in sustaining these trends. In China, an aging population and rising healthcare costs pose significant hurdles. The country must balance its economic growth with the increasing demands of an elderly population, which is projected to account for 30% of the population by 2050. In the United States, addressing life expectancy decline requires systemic changes that prioritize health equity, expand access to care, and address the socio-economic determinants of health. Lessons for the future. The experiences of China and the United States offer valuable lessons for policymakers worldwide. In China, the emphasis on universal healthcare and preventative care provides a model for improving population health, particularly in developing nations. In the United States, the need for systemic reform underscores the importance of addressing socio-economic disparities and ensuring that healthcare is accessible to all. As global health challenges continue to evolve, both nations must adapt to new realities. The rise of chronic diseases, the impacts of climate change, and the ongoing threat of pandemics require coordinated efforts to promote health and well-being. By learning from each other's successes and failures, China and the United States, and indeed the global community, can work toward a future where health equity is a shared goal. We highlight the transformative power of public health initiatives and the importance of addressing systemic inequalities. The contrasting experiences of China and the United States serve as a reminder that life expectancy is not just a measure of health, but also a reflection of societal values and priorities. By investing in health, equity, and sustainability, nations can create a foundation for long-term prosperity and well-being.
Thank you so much for watching. If you found this video valuable, please give it a thumbs up and hit the subscribe button. It's one of the best ways to help more people see this content. I'd love to hear your thoughts. So leave a comment below and join the conversation about today's topic. Your engagement and support mean everything to me and make it possible for me to create more impactful content that aims to bring the world closer together. If you'd like to take it a step further, you can support the channel directly through the link in the description. Every bit of support helps this community grow and fuels the mission to make a difference. Thank you for being such an important part of this journey.